All 10 of the deadliest conditions that affect Americans can be influenced by lifestyle choices. Every single one. Stay tuned to learn more about the 10 things most likely to kill you and what you can do about it. I'm Dr. Vicki Petz Casper. I practiced obstetrics and gynecology for 20 years until I landed on the other side of the sheets as a very sick patient. When my own body betrayed me, I took a handful of pills to manage my disease and another handful to counteract the side effects. My health was out of control. Through surgery, medications, and lots of prayers, I regained my strength only to face another diagnosis. My doctor challenged me to make radical changes through lifestyle medicine. Now I feel great and I want to help you make changes that make a difference. Healthy Looks Great on You podcast takes you to many medical schools so you can learn the power of lifestyle medicine. If you're ready to take control of your health, you're in the right place. Whether you're focused on prevention or you're trying to manage a condition, I'll give you practical steps to start your own journey toward better health, because healthy looks great on you. This is episode 133, the top 10 things that will kill you and what you can do about them. Are you one of those people who are proactive and health conscious? Or does it take a wake-up call for you to get serious about taking care of this one bag of flesh and bones that you're going to live out all of your days in? You know, my mom brings her patio furniture chair cushions inside the house every time there's rain in the forecast. And man, those cushions are as brightly colored as the day she bought them. Me, on the other hand, well, let's just say a little rain, a little snow, a little ice, and a lot of intense heat has taken its toll. And I'm going to have to buy new ones. And listen, they aren't cheap. But here's the deal. Our bodies have to last. So we really ought to take care of them before the damage is done. But even then, I've got some good news for you. Many health conditions can improve or sometimes even reverse with lifestyle modifications. But you've got to be serious about making changes, especially if you already have evidence of wear and tear from the harsh elements of your lifestyle. Today, we're going to talk about the 10 things most likely to kill you and how lifestyle impacts each one of them. Because the good news is that lifestyle matters. Or maybe you think that's bad news. But I think you already knew that you can't neglect your health and expect a good outcome for all the colors to hold fast no matter what the weather. Don't wait for a wake-up call. Start today. Now, I know change is hard, and that's why I created the 7-day prescription for change to help you tap into your strengths and motivations and give you the tools you need to start making healthier choices. Go to my website, healthylooksgreatonyou.com, or I'm going to put a link in the show notes. And remember, it's Healthy Looks Great, not good. As we go through the list of the top 10 things that will kill you and what you can do about it, we're also going to take a look at the most recent change. Okay, let's push pause for just a minute and go to mini medical school to talk about data. I said change is hard. Statistics are hard too. But for those of you who are not pursuing a career in epidemiology, here's the nutshell explanation. Mortality data in the United States is collected from death certificates by the Center for Disease Control. Now, do I think death certificates are 100% accurate? Not always. When my dad passed away of sepsis due to long-term complications from surgery which cured his bladder cancer, they put the cause of death as kidney cancer. I acted plumb silly trying to get them to change it and finally accepted bladder cancer as his cause of death, even though it had been cured. But anyway, he was in hospice. In hospitals, if they've taken care of a patient for a while, the data should be more accurate because they know what caused the death. Side note, 30% of people die in a hospital and another 30% die at home. That makes it a little harder to accurately record the cause of death. But you'll see when we talk about the Big 10, it's probably pretty reflective of the truth. Anyway, my point is that while the data may not be 100% accurate, looking at death certificates is a pretty good way to assess what Americans are dying of. So about the change. Only one disease recently moved all the way to the bottom of the top 10 list, and everything else stayed put. Want to guess what moved from number 4 to number 10 and why? We'll get to that, but I bet you know the number one disease that claims the most American lives is heart disease, with a grand total of over 700,000 deaths per year. A whopping 20% of all deaths are attributable to the old ticker. Who in your family has passed away from heart attack or heart failure? I'm pretty sure there's someone you love who's suffered with heart disease. And if you're personally affected by heart disease, there is hope. Stay tuned and we'll talk about what you can do to prevent and manage heart disease. Also, there's some more good news. Death rates from heart disease are decreasing. Now, if you did not answer heart disease for the number one cause of death, you probably answered with the number 2 cause, cancer. Cancer retained its number 2 spot on the list, but there is some bad news. Unfortunately, cancer deaths are increasing, and cancer is affecting younger people at an increasing rate. Sometimes we learn more on a field trip than in the classroom, so let's do a little exercise. Why do you think cancer rates are increasing? I'm not sure I heard you, but how confident are you that that's the answer? Because here's the deal. Nobody really knows why for sure. Of course, we all have our bias, and that's the tricky thing about understanding science. Could it be junk food and obesity? Possibly. We know the rates are skyrocketing, so it definitely may be a contributing factor. Here's what the research suggests. Lifestyle, especially increasing alcohol consumption, sleep deprivation, sugar-sweetened beverages, sedentary lifestyle, and eating ultra-processed foods. And other than alcohol, all of this starts in childhood. I want to acknowledge that some of you probably said COVID or the COVID vaccine, but the big uptick we've seen started in 2019. I'm going to dedicate an entire episode on understanding medical research, but even experts are prone to bias. So remember that when you try to do your own research. Cancer is a dreadful disease that causes 17% of all deaths in this country, claiming over 600,000 lives. And there have been so many great advances in the treatment of cancer as well as early detection, and yet it remains in the number 2 spot. Here are the top 5 cancers causing death in men: lung, prostate, colorectal, pancreas, and liver. Men can be screened for prostate cancer with a simple blood test. For women, lung is also number 1, not breast, it's number 2. And remember, breast cancer survival is extremely high, but early detection is crucial, so be sure and get your mammograms, ladies. Smokers should also get screened for lung cancer, and everyone needs a colonoscopy. And they're recommending it for younger people because this is one of those cancers that's increasing in younger people. And it's number 3 on the list for both men and women. Pancreatic cancer is the number 4 cause of death for both men and women, and it's kind of hard to screen for, but there are some promising things on the horizon. Number 5 for women is ovarian cancer, also difficult to screen for, and the symptoms are usually kind of vague, like bloating, fatigue, constipation, urinary frequency, pelvic and back pain. And I mean, a lot of women have that. But feeling full after just a few bites and losing weight, those add to the level of concern when these other symptoms are present. So to reiterate, smokers need a CT of the chest, men should be screened for prostate cancer, women should have a mammogram, and everyone needs a colonoscopy. In the prevention category, besides healthy choices, I want to mention that the HPV vaccine has really impacted the rates of cervical cancer in women and oral cancers in men and women. And even though lung cancer is number 1 on the list of cancer deaths, less people are smoking, and the rate of lung cancer is decreasing nearly 3% a year. So we may see a change in the ranking in the future. Moving on to the number 3 cause, accidents. Over 200,000 lives are tragically lost to accidents. Is that lifestyle related? No, sometimes. Alcohol and drug use are contributing factors, but also physical deconditioning can lead to falls, and that can be fatal. Next on the list is stroke, and this is a fairly new spot for stroke because remember I told you that what used to be number 4 is now number 10, and we'll get to that in a minute, but there are 2 types of stroke, hemorrhagic and embolic. And let's camp here for just a minute and go back to mini medical school to learn a little more because the death rates from stroke are decreasing due to educational efforts to recognize symptoms early and the development of effective treatments. In medicine, we say Time is brain, because every minute that the brain is without blood flow and oxygen results in more damage. Blood flow can be disrupted by a couple of different mechanisms. First is hemorrhage. This occurs when a blood vessel in the brain either leaks or ruptures, resulting in a brain bleed. The other and more common type of stroke is ischemic, accounting for 87% of all strokes. Both types are called CVA or cerebral vascular accident. Ischemic strokes are caused when blood flow is cut off or reduced, and this can happen because of narrow, damaged blood vessels in the brain, a clot or a plaque that breaks off and gets stuck, or even from very low blood pressure. It's super important to know the signs and get emergency treatment early. If you only remember one thing from the podcast today, remember, be fast. B stands for balance, E stands for eye, F stands for face, A stands for arm, S stands for speech, and T stands for thunderclap. You heard that right, thunderclap. Well, let me break it all down for emphasis. Remember, strokes happen pretty quickly, and the damage is done pretty quickly too. So be on your toes, be fast, be balanced. This is when someone suddenly loses their sense of balance. E is for eyes, sudden loss of vision in one or both eyes. F is for face. You can see the side of the face drooping. A is for arm, and the arm may be weak or even hanging down, but it can also affect the leg. I guess be fast was just too hard to say. S is for slurred speech or confusion, and back to T for thunderclap. This is a sudden severe headache that people describe as the worst headache of my life. Fortunately, hospitals participate in stroke accreditation programs that give them access to experts by telemedicine, even in remote areas. So, if someone you love is experiencing symptoms of stroke, call 911 and let the ambulance take them to the nearest hospital, because time is brain. If a stroke is caused by blockage, then clot-busting drugs can be given. The sooner the better, because they work. Of course, they don't work for hemorrhagic stroke, and in fact would make that worse. So it's important to rule out hemorrhage with CT or MRI. But here's something you might find interesting. Stroke doesn't always show up on imaging right away. So even if a CT is normal, if a person shows symptoms of stroke, they'll be given the clot busters because tick, 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 tick. That's right. Time is brain. Some things kill you fast and others are slow. Coming in at number 5 is chronic lower respiratory disease. This includes COPD, asthma, emphysema, and pulmonary hypertension. Chronic respiratory disease takes the life of 140,000 people a year, mostly over the age of 65. 5 times more adults die of asthma than kids, but of course, it's especially tragic in children. Access to adequate treatment is important, and listen, some of these medications are really expensive. Of course, smoking is a big risk factor for COPD and emphysema, and it makes asthma way worse. And there are other lifestyle factors that affect it too, like obesity. We'll get to treatment and prevention, but right now, we're at the halfway mark for the top 10. To review, heart disease, cancer, accidents, stroke, chronic respiratory disease, and next up is Alzheimer's. If it seems like more and more people are being diagnosed with Alzheimer's, it's true. Like cancer, the rates are increasing. Currently, 120,000 adults die from brain failure every year. Most people die within 8 years of diagnosis, but some people live up to 20. Because they don't have proper nutrition and they can't swallow, things like pneumonia are usually the final insult. Over the last 20 years, deaths from Alzheimer's have increased by 55%. You heard that correctly. In this country, there are 6.5 million people living with Alzheimer's. Although there is no cure, lots of research is being done, and there are new treatments. Contributing genetic factors have been identified, as well as early diagnostic tests. But here's the good news. Just because you have a gene for Alzheimer's does not mean you can't modify your risk with lifestyle changes. I have an entire episode dedicated to preventing cognitive decline and also one for caregivers of dementia patients. Those will be links in the show notes, or you can go to my website and search for the episode. But if this is a topic that interests you, you'll want to sign up to receive every episode by email so you don't miss any upcoming episodes, because there have been some new studies published lately that you'll not only find interesting, but informative and empowering. Usually, the number 7 is considered lucky, but any of the 1.7 million adults living with diabetes would tell you otherwise. Diabetes is the 7th leading cause of death, claiming 100,000 lives a year in the United States. And it's not just us. In 2021, there were 6.7 million deaths worldwide attributed to diabetes. That totals 12% of all deaths in the world. And it's probably underestimated because it's the underlying disease that causes the other diseases that kill you. In fact, on this top 10 list, at least 4 of them can be pretty closely linked to diabetes and maybe more. Some people even call dementia type 3 diabetes. Of course, I have a whole episode on diabetes. Finishing at number 8 on the list is kidney disease, which is directly impacted by both diabetes as well as hypertension. Total lives lost is about 58,000. Barely trailing is number 9, chronic liver disease and cirrhosis, mostly caused by an increase in alcohol consumption, accounting for a loss of nearly 55,000 lives per year. Not to mention the toll on relationships, jobs, life fulfillment, and productivity. And number 10, which used to be number 4, is COVID-19. In 2021, it was number 3, then it moved to number 4, then it fell to number 10. The mortality of COVID has plummeted due to immunity, but don't discount the fact that it still holds the number 10 spot. I suspect it will continue to fall and be lumped in with other causes of fatal pneumonia, like flu. These 10 leading causes of mortality in the United States comprise nearly 3/4 of all deaths. So what are we going to do about it? First of all, we're all going to die of something, right? Recently, I bought a funeral to plan for my exit from this temporary world into my eternal home, where I have a confident hope that I have a room reserved in the mansion Jesus prepares for those who love him. Meanwhile, I want to take care of this tent I'm living in because I want to live life to the fullest for the days I'm assigned to live on this planet. And since you're still listening, I'm going to assume you feel the same. Sometimes disease just sneaks up on us, and there's not much we can do. But let's talk about the things we have the power to change by walking through the 6 pillars of lifestyle medicine and their impact on the leading causes of death: heart disease, cancer, accidents, stroke, chronic respiratory disease, Alzheimer's, diabetes, kidney disease, liver disease, and COVID. I'm going to start out with substance use. Less and less people in America smoke, and more people in America drink, and they drink more. Now, don't push pause if I stepped on your toes. Hear me out with some facts. Just the facts. Smoking increases your risk of heart disease, cancer, stroke, chronic respiratory disease, Alzheimer's, diabetes, and dying from COVID. In fact, your risk of diabetes goes up by 30 to 40% if you smoke. Nicotine actually raises your blood sugar, and all those other chemicals cause inflammation, which negatively affects your body's ability to regulate blood sugar. If you smoke, your risk of heart disease is increased by 2 to 4-fold, and your risk of stroke doubles. And this is because smoking causes the blood vessels to constrict and decreases cardiac output. That's the amount of blood that your heart pumps into the body. So there's less oxygen in the blood, and the vessels are damaged, and there's an increased risk of clotting. When I was practicing obstetrics, occasionally I'd have a patient in labor who needed a smoke. And of course, we didn't allow that in the hospital, but every once in a while, a lady would sneak into the bathroom and light up. Like we couldn't tell. Anyway, they'd hop back in bed, and the nurse would strap the monitors on and call me in an absolute panic because the baby's heart rate would be showing evidence of severe fetal distress due to lack of oxygen. Scary stuff. But imagine that's what happened throughout pregnancy every time she smoked, and nobody was monitoring the baby. It's sad, but it's a good demonstration of how smoking affects circulation. Of course, lung disease like COPD and emphysema are also associated with smoking. So is depression and many types of cancer, not just lung. In fact, 1 in 8 cancers are caused by smoking. Some of them might surprise you: lung, mouth, throat, nose, sinus, esophagus, bladder, kidney, ureter, pancreas, stomach, liver, cervix, ovary, colorectal, and acute myelogenous leukemia. Smoking is the leading cause of preventable death in the United States. Quitting isn't easy, but here's one thing I want you to hear if you're a smoker. The average number of quit attempts before success is 7. So if you've tried before and it feels hopeless, try again. Use the 1-800-QUIT-NOW resources and see your doctor about taking medications. And that's plural because most people need more than one, and one of them is nicotine replacement. Smoking has become less socially acceptable than in years past, but keep those steel-toed boots on because let's talk about the effects of alcohol. Attitudes about alcohol and social norms have changed in recent years. Most middle-aged adults think that it's okay. In fact, we used to say that drinking red wine was good for your health. Now, studies show that young adults between the age of 18 and 34 understand the facts, and kudos to them. That being said, 85% of adults drink alcohol, far more socially acceptable than smoking. And it's worse in older adults. As baby boomers hit retirement, alcohol use trends up, especially in women. An alarming 107% increase in the rate of alcohol use disorder has been reported in the over 65 crowd. Yet, alcohol increases the risk of heart disease, cancer, accidents, stroke, Alzheimer's, dying from COVID, and, of course, liver disease. Cancers with a proven link to alcohol include head and neck, esophagus, liver, breast, and colorectal. And remember, accidents are number 3 on the list, and 32% of fatal car crashes involve driving under the influence of alcohol. And that doesn't include falls and other accidents related to impairment. Plus, there's a new study published in the Journal of the American Medical Association, Network Open, that's all the buzz in the world of medicine. It shows adults over the age of 60 who drink alcohol on a regular basis are at increased risk of dying, mostly from cancer or cardiovascular disease. They compared those who drink a couple of times a week to people in a high-risk group, and that's men who drank an average of almost 3 drinks a day or women who drank 1.5 drinks a day. These people in the high-risk group had a 33% increase in early death, a 39% increase in cancer death, and a 21% increased chance of dying of cardiovascular disease. And like smoking, quitting is hard. But unlike smoking, there's a huge denial factor. If you think you might need help, AA and Celebrate Recovery are the best resources I can recommend. So we know alcohol is not good for your health, and we all agree that smoking is bad for you. But did you know that loneliness is as bad for your health as smoking 15 cigarettes a day? And I have a whole episode on that. But the startling statistic is that 1 in 2 adults struggle with being lonely. And that is not a good indicator that we are moving in the right direction. I have an episode on stress too, and it takes an incredible toll on our bodies. And the chemistry of it all is fascinating. Good sleep can increase your lifespan. A large study showed that men who get enough Z's live an average of 5 years longer, and women get an extra 2 years for good slumber. But over 30% of Americans don't get enough sleep, and that is directly linked to an increased risk of, number 1, heart disease, number 2, cancer, number 3, accidents, number 4, stroke, number 6, dementia, and number 7, diabetes. Here's what's supposed to happen when you sleep. Your heart rate and blood pressure drop during non-REM sleep, and that alleviates some of the strain on your heart from pumping blood throughout your body 24/7. So if you don't spend enough time in non-REM, then your metabolic function is impaired, there's more inflammation in your body, your blood pressure is higher, and therefore so is your risk of heart disease from both hardening of the arteries and buildup of plaque, as well as heart failure. In fact, the chances of having a heart attack go up by 20% in people who sleep less than 6 hours a night. What about cancer? Breast, colon, ovarian, and prostate cancer are associated with inadequate sleep. It's hard to estimate how many accidents are caused by drowsy driving, but it's suspected to be on par with drunk driving. Poor sleep, either from too little or things like sleep apnea, cause an increase in blood pressure, and that is a leading contributor to stroke. Not only does a good night's sleep improve memory, it also decreases your risk of dementia and death. In fact, a Harvard study showed that people who snooze less than 5 hours a night double their risk of dementia, especially if that shorter sleep time is during midlife. And it's well known that poor sleep impairs glucose metabolism and contributes to belly fat and is strongly associated with diabetes and obesity. Now, let me give you 10 good reasons to exercise. It reduces the risk of dying from heart disease, cancer, accident, stroke, chronic respiratory disease, Alzheimer's, diabetes, kidney disease, liver disease, and COVID. Doesn't that make you want to lace up your tennis shoes? Aerobic exercise and strength training are good for your heart. People who exercise regularly are at decreased risk for some cancers, specifically bladder, breast, colon, uterine, esophageal, kidney, and stomach, and it may help prevent cancer in the lung, pancreas, prostate, ovaries, thyroid, liver, and rectum too. Exercise does so many great things for your body. It affects hormones, insulin, blood pressure, inflammation, immune function, digestion, and metabolism. And it helps with obesity. Want to know what else it can help with? Recovery from addiction. Substance use disorder is tied to altered brain chemistry. And guess what exercise does? It increases serotonin and dopamine levels. In addition to making your muscles stronger, physical activity makes your heart and lungs stronger, oxygenation increases, and therefore shortness of breath decreases. It also strengthens your bones, so you're less likely to fall and less likely to break if you do. People who exercise typically sleep better and are better able to manage stress. Physical fitness improves memory and reduces the risk of dementia. I briefly want to mention social connectedness. Turns out we really do get by with a little help from our friends. Think about it. People with a good support network are likely to be successful in the other pillars of lifestyle medicine. Exercising with a friend makes you more accountable. Participating in support groups helps with recovery from substance use. Having friends can certainly reduce stress. All of that combined makes you sleep better. However, it may not help with the final pillar of lifestyle medicine that we haven't talked about yet, and that's nutritional eating. And what do I mean when I say nutritional eating? Well, I mean whole food, plant-based, not ultra-processed foods, because 8 of the top 10 things that can kill you are linked to ultra-processed foods. Heart disease, cancer, stroke, chronic respiratory disease, Alzheimer's, diabetes, kidney disease, and COVID. I remember early on during the pandemic, a lot of people were saying, we should be talking about the obesity epidemic. And obesity definitely increases the risk of mortality from COVID. But now that the pandemic is over, let's don't forget that as a nation, we're not healthy. Eat real food with real nutrients instead of junk food, and it would make all the difference in the world. But, like stopping smoking or drinking, managing stress, or starting an exercise program, it's just not that simple. Old habits are hard to break. If you want to get healthier, consider a consultation with a lifestyle medicine physician. Here's a word from our sponsor, Equilibrium Medical.
This episode is brought to you by Equilibrium Medical, a telehealth lifestyle medical practice. Are you ready to maximize your health? Whether you are struggling with weight loss, poor sleep, or too many medications in the medicine cabinet, lifestyle medicine can help. If you live in Arkansas or Tennessee, visit www.equilibriumtelehealth.com today and schedule an appointment with a board-certified lifestyle medicine physician. You can have your visit from the comfort of your own home, with no waiting and no interruptions.
Getting healthy and staying healthy is hard, but it's so worth the effort because healthy looks great on you. The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.